Hi, my name is Atiqa and I'm from Group 23. I will be demonstrating about defamation and also how to communicate with patients who have special needs. So defamation, it means that it involves false statements that are presented as fact that will harm someone's reputation or simply character. There are two examples of defamation, one which includes libel. Libel is defamation in the form of written, published material, and the other one is slander. Slander is also defamation, but in the form of spoken or oral. One of the examples of defamation is as follows. Hey, you know the patient we had last Saturday, the one we operated on? You know that she's a famous celebrity, right? I just heard that she has herpes. Herpes? Really? She had herpes? So those rumors of her sleeping around is true. Huh. Exactly. So what I'm going to do is I'm going to sell that information to any media outlet like TMZ, and I'm going to get a lot of money because of that. I mean, who wouldn't want that kind of information, right? That kind of scenario where two healthcare professionals were gossiping about a patient they treated having such disease. It's considered defamation because, first of all, the patient is not diagnosed with it. The information was known to them in the form of a rumor. So them or one of them trying to sell the information for the sake of personal gain is considered defamation, and you can get sued because of that. The next part of this video is a demonstration on how to communicate with patients with special needs or disabilities. We as humans, we communicate with each other every day, and it will not be something less for someone with disabilities. Sure, they have disabilities or special needs, but that doesn't take away the fact that we can't communicate with them at all, or they don't deserve any effective communication. So we have to see beyond those needs, those special needs of them, those disabilities, and see them and talk to them as an individual. Here are some tips for successfully communicating with patients with special needs. The first of them would be speaking in a normal tone. This shows that we are talking to the patient beyond their disabilities or special needs. We are talking to them as a human. We are talking to them as an individual, and this will make the patient feel heard, feel seen. The second step would be to be polite and patient, because they have patients with special needs. They may feel intimidated because probably throughout their whole life everybody sees them as a nuisance, and it may intimidate them. So us as healthcare workers, we have to be there for them. So we have to be accommodating for them. The next step is to speak directly to the patient rather than speaking to the person or someone accommodating them, because it is about the patient with disability. So we need to know exactly how said patient feels, and we want their voices to be heard. The third tip is to ask the patient what will help in their understanding. So if they understand well with visual images and so on, we can try using that method to make them understand and make them involved in their health. Next is to not pretend that you understand what the patient is saying when you actually don't, because in a way it's a form of deceit to the patient, and this will make the patient lose trust to your services, to your role in treating the patient's health. So instead of lying to their faces or pretending that you understand everything, keep on asking simple questions, like, for example, yes and no questions. It's a close-ended question. So it will make your understanding of the patient better with those questions. Also, we have to be flexible in explaining certain stuff to patients. And if the patient doesn't understand what is being said, rather than repeating, we just have to reword those information in a manner that the patient understands more. So don't really use medical jargons like healthcare professionals use often. Use simple terms when communicating with them. After that, when communicating with patients with disabilities, special needs, offer assistance to them if it's necessary. But if it's not needed, don't force it, because patients with special needs, the stigma surrounding them is them being helpless or not being able to support for themselves just because of them having a disability. But it's not. They can actually support themselves, but it may be in a different way compared to those who are normal, those who are healthy. Next part is to only refer to the patient's disability when it is needed or necessary, because patients with disabilities, they might find that them having their disability is something sensitive, and they wouldn't want it to hear from other people. But unless delivering certain information that really requires said disability to reinforce statements, then yes, it's necessary. And we have to consider the patient's feelings for it. In conjunction to that, avoid saying anything that implies the patient with special needs, if they are a superhuman or courageous or special, because those terms, they might seem like encouragement, but to patients with special needs, they just want to be seen as a regular human being. They want to be seen despite having such disabilities that people think are limiting to them, and so on. And lastly, everyone makes mistakes, so relax, apologize if you think you did,